My patient has no heartbeat. Anyone tells me why her heart stopped gets an A in Dr. Cuddy's class.
Human error?
You know House is getting desperate when he goes to first year med students for a consult. Not disappointed. Very excited to be reacting to House MD Season 3 Episode 24, the series finale, Human Error. On this channel we are reacting to all 177 House videos and this will be Episode 82. Let's see if I can get the diagnosis before House does as a doctor working in rainy London.
We're light on fuel. 2 minutes to bingo.
Working on it! Let go of the suitcase! The well! Sir, whatever it is, it's not worth it!
He says it wasn't her clothes, it was her medical records.
I need to see Dr. House!
Your patient's been waiting for hours.
She didn't book an appointment.
No, she risked her life.
The woman has 10 different things wrong with her.
Infectious disease and parasites are the most likely cause of unexplained pain, fever, and skin rash. We might as well start there.
The season finale did not disappoint. Did you see that production value in the sea? Spicy stuff. So what do we know so far? Our patient is the wife who is from a Spanish-speaking country and lost her medical records trying to cross for a consult with Dr. House. The only symptoms we know of so far are multiple joint pains, fever and rash, which can be caused by a lot of different things including Lyme disease, dengue fever, chikungunya or even Zika virus. Without her medical records, the team need to start from scratch, doing a history to assess for any bites, surgical procedures or odd exposures when the symptoms started and how they've progressed. You'd also want blood tests, viral throat swab and a chest x-ray, but a big giveaway could be how the rash looks. You see, on some occasions we can be 90% sure of what a condition is just from looking at the type of rash. Like Lyme disease makes this interesting target shaped rash called erythema migrans. A butterfly rash which forms on the face can indicate lupus, or shingles also has a characteristic localized dermatomal rash which is a reactivation of herpes virus within a nerve. There's a huge source of medical health inequalities here though. We're trained to spot rashes mainly on white skin. One study out of Switzerland tried to begin quantifying this difference in 2022 when it assessed how well healthcare professionals correctly diagnosed children with dark skin. Only 11% of healthcare professionals actually reached the pass mark in that test, which is very concerning. There's some work being done to try and rectify this, like putting side-by-side comparisons of how different conditions like eczema look on different skin colors. What other symptoms could this patient have though? Let's find out.
Pain, double vision, point us towards the head. Cameron, get an MRI. Chase, check out the husband.
Does have a fever, fungal rash, cough, and elevated bilirubin.
Start her on interferon for the MS, see if she improves.
Well done. Do it.
Well done. Is that what you think he wants? A pat on the head?
The stakes are rising as if House doesn't do something soon, then Foreman will be leaving the team for good. It's mainly because he thinks House is an unethical ass and would like to turn into him about as much as a pleasant sleep on a bed of nails. House now needs to prove that he isn't who Foreman thinks he is, and inside that tough caterpillar exterior is a beautiful butterfly waiting to be released so he can stay and live happily ever after, until he realizes it's a Heliconia sydno butterfly that can produce its own cyanide. What could be even more interesting though is that we have some new clues. After eliminating the symptoms from almost drowning, as the husband has them too, we're left with pain, fatigue, double vision, cotton mouth and brandy urine. The spicy, more specific ones on that list are the double vision and brandy urine. Yes, Foreman is right that MS can cause double vision in someone of her age and gender, as it can affect the nerves that regulate the motion of the eye. It doesn't quite explain the brandy urine though, so what could that be? Well, dark brown urine could be because of muscle injury or myoglobinuria, malaria and kidney problems. None of those really explain the cotton mouth and double vision though. They're more neurological. Another way to think about this is, what advantage would House's team have over the team back in her Latin country? Imaging equipment. So the original team could have missed a kidney or other urinary tract tumor that led to the change in urine color and caused the rest of the symptoms. That will be my first diagnostic guess. She may have even been exposed to toxic dye that made it more likely. Question for you smart people. Industrial exposure to what substance classically causes bladder cancer? Answers down below.
Your pain is getting worse. Your treatment isn't working because it's not MS.
Foreman didn't break her arm. Put her in a PET scan. See what else it's breaking.
He's not a moron. You can't just agree with everything he says for 2 days and hope he forgets the last 3 years and how much he hates you.
I don't really care if Foreman stays or goes, but
You're fired.
What? Chase is a team member who's gotten the most diagnoses correct in the whole series, and House just headshots him when he's already losing one of his team that quite literally just leaves him with Cameron. This shakeup makes for incredible TV though. In real life, the way supervision works is complicated though. My attending during training wouldn't have the power to get me fired. They could recommend I get more training or ask that I move to a different team, but you'd have to do something pretty horrendous to just straight up get the sack. During my 7 years as a doctor, I've never seen that happen. Countries are too short of doctors to let them go that easily. Medicine can be tough, not pay well compared to the time investment put in, and be unsatisfying at times, but one thing it will never be is an unstable career. That's partially why so many Arab and Asian parents like the idea of it. One observation here though is the patient's husband just made a full rant in perfect English. If his language skills were that good, why was he only speaking Spanish when he was being rescued at the start, needing a translator as well? Either that's a bit of an oversight from the writers, or the man learns faster than Ziad Fazar, a man who can read and speak 58 languages. Either way, I need to know why Chase got fired.
What, because I yelled at you?
Because you've been here the longest, learned all you can. It's time for a change.
No hot spots, no bone cancer.
about the humerus. She's got a hot spot.
What the hell's wrong with you? You fired Chase?
Unfire him.
Dr. Chase, you're still fired. PET scan revealed a blood clot in my patient's arm.
We have to do an emergency angiogram.
Did you give an angry Cuban my home number?
Oh, giving out a personal number is a big no-no. I've had a few patients ask me if they can have mine, and I have to politely decline. It especially happens with patients of the same ethnic origin as me, as they feel they can use that connection to call in a favor. It may seem like a good idea getting direct access, but it could lead to corridor consultations where you give advice without the patient's notes and have nowhere to document the consultation. We've seen how this can go wrong with Chase in a previous episode. Another way it can go wrong is if you do it for one person, then why not the others? It makes so many ethical and practical problems that it's just best not to start. Also, who wants to be called at 3 AM for an emergency that you're not equipped to deal with? Now, we know that the PET scan found a clot in the arm, and the team are thinking that it's coming from the heart. Do you know what the usual next step is in this situation? It'd be an echo of the heart, as the most likely cause in a young fit person would be something like endocarditis. That's infection in the heart valves, throwing off clots. The angiogram which Foreman wants to do would be great at checking the large vessels leaving the heart or small coronary arteries supplying the heart with blood and oxygen when it relaxes, but not for checking for endocarditis, which is what they think this patient has. The coronary arteries or large vessels of the heart wouldn't really trigger this clot in the arm in the absence of other symptoms. I'm interested to see how this now develops.
My chest.
She's in VTAC.
What did you do?
Nothing.
She has no pulse.
It hurts.
She has no pulse, but she's talking.
No ST segment changes.
Keep going till I figure this out.
House, I'm busy.
Foreman and Cameron are doing CPR.
Then you shouldn't have fired Chase.
The patient's conscious during a cardiac arrest. House has had an actual Chimero patient explain how a virgin birth is possible and infected his staff with Legionella to save their lives. All had a scientific basis, but this raises the bar. I've never seen a patient conscious during CPR, but there is a colourful account from 2018 by a guy called Gray. A 38-year-old man went to a remote emergency department in Canada and was pale, sweaty, and looked like death. His blood pressure and heart rate were dropping to levels incompatible with life, and his ECG showed a massive heart attack. The team then filled him with fluids to try and recover the blood pressure before transfer. They thought the heart attack was because of a clot, so they needed to try and bust it with a medication called tenecteplase, but 7 minutes after administration, he became unresponsive as his heart stopped beating. They tried to resuscitate him for 17 minutes of CPR, and at some points his heart was stopped. He still was purposefully trying to resist the CPR. He even spoke out once or twice while being shocked, and he had to be restrained to stop him fighting. After 6 shocks and 3 doses of adrenaline, the team managed to restart his heart and stabilize him enough to go and get his blocked coronary artery revascularized. What's even crazier is he was interviewed 3 months after that experience and he remembered feeling the shocks that made his muscles tense. The thing is, so many of the team members involved in that resuscitation didn't know that it was possible that he could be conscious while his heart had stopped, and that made them concerned that CPR wasn't the right management. I mean, imagine shocking a literal conscious person in front of you. Sedation is an option, but most patients don't recall experiencing pain specifically during the event. Now, this patient is way more conscious than the reported one and has asked her to keep coughing. But why is that? Well, forceful rhythmic contractions is almost like doing CPR on yourself. It activates the chest and abdominal pump mechanisms, leading to blood entering the left heart and reserves of blood from the abdomen being released into the bloodstream. That means during an unstable heart rhythm, repetitive coughing could help maintain blood flow to the brain and consciousness. I've never seen that used in practice, but good to know in case you're having a nice walk in the countryside and your heart decides to act like it's in a techno rave. It's not quite clear what could cause this, as the usual suspects have been ruled out, but how will House get more clues?
Someone's gotta talk to the husband. He thought this whole thing was gonna last 45 minutes.
We gotta get her on bypass.
My patient has no heartbeat. Anyone tells me why her heart stopped gets an A in Dr. Cuddy's class.
Human error?
You know House is getting desperate when he goes to first year med students for a consult. This human error thing keeps popping up though. The team were quite keen to ask Foreman what he did during the procedure with the wire, as she had the cardiac arrest while he was going into her heart. What if that's misdirection though? Maybe it is human error, but not for the reasons we expect. What if they had her medical records? It could show that she has an allergy of a certain type to an anesthetic, or maybe a clotting disorder that would have made this procedure unnecessary. There are so many different types of human error that medical negligence is the 3rd leading cause of death in the United States. That is a staggering number. Foreman making a mistake now would be oddly convenient as well for House to be able to keep him as an employee, as it could just make him lose his confidence.
Botox injections.
F.
If the injection was tainted with live botulism, it fit.
B+. Send me your resume.
Either our patient goes on bypass or I call time of death.
House. Bypass. Now.
My wife, what has happened?
Her heart stopped. We have to get her on bypass.
You just sit here. You don't talk to people. How do you fix something if you don't look at it?
Need to look at the heart.
Did you say anything wrong?
Give her a jump start.
Clear.
Again.
Yeah. 7th time is the charm. She's dead.
Other than your curiosity, do you have any reason to keep her on bypass?
The patient's husband prefers her not dead.
It's time to let go.
She's not coming back.
Your heart. It beats.
What? This man has quite literally crossed the ocean to save his wife, and at the moment that he thought all hope was lost, just when he was about to give up, the patient lives. This season finale has not disappointed. Believe it or not, we call this condition Lazarus syndrome, which is named after the biblical story of Lazarus. It accounts that Jesus loved a beggar named Lazarus and was in deep mourning when he died. Lazarus was in a tomb for 4 days before Jesus revived him. The story was depicted as showing the power of Jesus over the last and irresistible enemy of humanity, which is death. Whether through divine forces or not, Lazarus syndrome is very real, but an exorbitantly rare occurrence. It reminds me of a case from 2001 where a 66-year-old man was brought to the emergency department with an abdominal aortic aneurysm. When those aneurysms burst, the chances of survival are 50-50. He unfortunately had a cardiac arrest while the team were trying to revive him, and they then tried to resuscitate him for 30 minutes but pronounced him dead. All the measures showed that this man was not alive. His pupils were dilated, his ECG was flat, no breathing. 10 minutes later, his pulse just restarted at normal rhythm like he's had a long snooze, and he began breathing again. They fixed his aneurysm and he survived with no neurological problems. Absolute madness. What could have happened here? Well, House is worried that the bypass machine could have dislodged a clot, but heparin is usually added, which thins the blood and helps dissolve clots. One potential cause that would fit the title is that air was trapped inside the lungs after it was being pushed in too quickly. Then, as the pressure in the chest drops, the air spontaneously releases, and the resistance reduces, and the heart can start pumping again. It could also be because the medication needed time to get to the heart and have its effect before beginning to function. None of these explain the human error title though, so let's find out more.
T-wave, QRS, T-wave.
So?
Marina.
Holy crap.
It's a miracle.
What if it wasn't human error? What if it was God's error? A congenital defect. We need to do another angiogram. I better not see you praying. I don't want to have to fight for credit on this.
What's that?
Third ostium. How many is she supposed to have? Dos.
Oh, that defect is rarer than a clean public toilet. You see, an ostium is an opening, and the arteries that supply the heart usually come from two main ones: the left mainstem artery and the right coronary artery. This patient has a third opening, which is acting like a middle child, always causing problems and throwing tantrums in the form of clots when it doesn't get what it wants. It could attract inflammation leading to vasculitis that's triggering all her symptoms, so crazy diagnosis. I would have never been able to get that without the angiogram though. Now guess who House is going to blame for this? I'll give you one clue. It starts with G and ends with odd.
All the third one's doing is causing inflammation, throwing off clots, getting in the way of the angiogram. No human would screw up that big. Just one more surgery, and we'll be fine. This is it. Thought you were the best guy for the job, which is why I want you to stay.
I don't want to solve cases. I want to save lives.
Do you think the children she can now have because of me are gonna care why I saved her? Better be naked pictures.
My resignation letter.
Genuine American cigars.
It's very hard to lose your people.
I think I'm okay.
American cigars to celebrate the health of your Cuban patient. How poetic. What is slightly less poetic though is how House's entire team have now decided to leave him. Is anyone surprised? No. House as a boss must be like answering to the love child of Thanos and Voldemort. But as one door closes, another one opens, and I've already seen a few episodes of season 4. Trust me, it's spicy. This was definitely an above average episode. Good one to clean up the season. A solid 7.5 entertainment. 6 out of 10 accuracy, as it's dubious the artery would have created a vasculitis to this degree. And I would say a 7 out of 10 diagnosis. This episode only makes sense though when you watch the previous one where House meets a patient that makes him look nice here.